I often say that a pathologist examining a pathological process under the microscope is like a god on Mount Olympus looking down at the mortals as they are struggling. I'll show you what I mean. You could almost imagine you're an eagle flying over plains and mountains, or, not to sound so vintage, like a drone filming a new documentary. It's very reminiscent of a computer game, one of the military strategic ones, only that it's not a game. You can see the armies on the battlefield. This army here is the cancer. These are mutant tumor cells, mutant orcs, if you like. They're ugly, distorted, and very dangerous. They produce chemicals which can kill and dissolve our nerves, walls of blood vessels, connective tissue, and the parenchyma of our organs. How did they become like this? Where did they come from? At the edge of the slide, I saw some preserved colon mucosa. Let's zoom to it. This is the inner lining of your intestines. There is some resemblance in these cells with their elongated nuclei to the mutant tumor orcs they turned into. At any point, in any of these cells, the DNA of the nucleus can start mutating and ultimately turn into the orcs we just saw. What makes it happen? We don't exactly know. What we generally know is that the cause is a combination of bad genetics and too much processed food in the diet. And the pinkish terrain surrounding the tumor army, what do you think it is? That's a desmoplastic reaction, fibrous tissue. This one here is young, but in time it will become more collagenous and hopefully even hyalinized, very sturdy and difficult to penetrate by the tumor cells, an entrenchment built by our organism around the tumor. In time, it will have less blood vessels, not much food for the tumor in it. It will be like a barren land. When a tumor occurs, what do you think our body does about it? Just stand by and watch it grow? No, our organism tries to fight it. Well, once a tumor is big enough to be clinically evident, it's a very rare thing for our body to manage to destroy the tumor. But what it can definitely do is slow it down. And this is the exact purpose of this barren land our organism placed around the tumor. And these are platoons of our own army, our immune cells. Here you see them as tiny dark dots. That's because of the histological dye. It stains them violet. But in vivo, they'll be white. And this is how they got their name, white blood cells. These are lymphocytes, numerous Roman legionaries. This is the always hungry samurai macrophage. Next to it you see a plasma cell. These are guardsmen eosinophils in their bright pink uniforms. And that's the short-lived but very destructive neutrophil, kamikaze. Every different type of soldier have their own specific virtues and disadvantages. Most of them are going to die fighting, but that's irrelevant. Their purpose is to buy enough time for the patient to get adequate medical diagnostics and treatment.